Hello everyone, and welcome back to the channel! Today, we're diving deep into a topic that's absolutely crucial for anyone in the healthcare field, especially dentistry, treatment planning. You might be a student, a new graduate, or even a seasoned practitioner looking for a refresher. So, what exactly is treatment planning? Think of it as creating a detailed roadmap for your patient's care. It's not just about fixing a single problem. It's about seeing the bigger picture, understanding the patient's overall health, their goals, and then systematically laying out the steps to get them to optimal oral health. A great treatment plan is comprehensive, logical, and patient. It's the blueprint for success, ensuring that every action we take is purposeful and leads to a predictable, high-quality outcome. Without it, we're just navigating in the dark. So, let's get ready to turn on the lights and map out the path to excellent patient care. First, let's break down the fundamental phases of treatment. A well-structured plan typically follows a specific sequence to ensure stability and long-term success. The first phase is the systemic phase. This is where we address the patient's overall health. Are there any medical conditions like diabetes or heart disease that could impact our treatment? Are they taking any medications? This phase is about risk management and making sure it's safe to proceed. We might need to consult with their physician or make modifications to our plan. Next comes the acute phase. This is for emergencies. If a patient comes in with severe pain, an infection, or a broken tooth, we address that immediately. The goal here is to relieve pain and stabilize the urgent issue before moving on to more comprehensive care. It's the put out the fire phase. After the acute issues are handled, we move into the disease control phase. This is the foundation of everything that follows. We focus on eliminating active diseases like cavities and gum disease. This includes things like fillings, deep cleanings, root canals, and extractions of hopeless teeth. We also provide intensive oral hygiene instruction. Think of it like building a house. You need a solid, clean, and stable foundation before you start putting up the walls and decorating. If you skip this step, any fancy work you do later is destined to fail. The goal is to create a healthy environment in the mouth that can support future restorative work. This phase is non-negotiable for long-term success. Once the mouth is healthy and stable, we can enter the definitive treatment phase. This is often what patients are most excited about. It's where we restore function and aesthetics. This phase includes more complex procedures like crowns, bridges, dental implants, orthodontics, and cosmetic treatments like veneers. Because we've already controlled the disease, the work we do here has a much higher chance of lasting for many years. This is where we rebuild the patient's smile and their ability to chew comfortably. The key is that this phase is built upon the solid foundation we established in the disease control phase. Finally, we have the maintenance phase, also known as the recall or supportive care phase. This is arguably the most important phase for long-term success. Treatment doesn't just end when the crown is cemented or the braces come off. The maintenance phase involves regular checkups and cleanings, typically every 3, 4, or 6 months. During these visits, we monitor for any new problems, check the stability of our previous work, and reinforce oral hygiene. This proactive approach helps protect the patient's investment in their health and prevents small problems from becoming big, expensive ones down the road. It's a lifelong partnership between the dentist and the patient to maintain oral health. Now that we understand the phases, let's talk about creating a detailed problem list. This is the heart of your data collection. Before you can plan anything, you need to know exactly what you're dealing with. The problem list is a comprehensive inventory of every single issue you've identified. It's not just about the teeth. You should organize it by category. For example, you might have a section for systemic concerns, another for soft tissues, one for periodontal issues, another for individual teeth or biomechanical problems, then function, and finally, aesthetics. Under each category, you list out these specific findings. For instance, under you might list generalized moderate gingivitis and localize 4 to 5 millimeters pockets on the molars. Let's make this more concrete. When you're building your problem list, be incredibly specific. Instead of just writing cavities, you'd write tooth number 3, mesial occlusal, decay, moderate depth. Instead of missing teeth, you'd list missing teeth number 14, number 19, and number 30. Why this level of detail? Because each specific problem will have one or more potential solutions. A vague problem leads to a vague plan. A detailed problem list allows you to systematically consider all the options. For each problem on your list, you should then brainstorm possible solutions. For that missing tooth, the options could be an implant, a fixed bridge, or a removable partial denture. This process ensures you won't miss anything and forces you to think critically about every aspect of the patient's condition. Once you have your exhaustive problem list and a list of potential solutions for each problem, you can start sequencing the treatment. This is where you put it all together into a logical flow using the phases we discussed earlier. You'll take the solutions you've identified and slot them into the correct phase. So, your disease control phase might include fillings on teeth, number 3 and number 12, and scaling and root planing for all 4 quadrants. Then, your definitive phase might include crown-on tooth number 12 and implant placement at site #19. This sequencing is critical. You wouldn't place an implant in an area with uncontrolled gum disease, right? Sequencing ensures that each step builds upon the last, creating a stable and predictable outcome. To wrap it all up, let's summarize the entire process. It all starts with a thorough examination and gathering all necessary data, your x-rays, your perio chart, your photos. From this data, you create a highly detailed, categorized problem list. For every problem, you identify potential solutions. Then, you take those solutions and organize them into a logical sequence based on the phases of treatment: systemic, acute, disease control, definitive, and finally, maintenance. This structured approach is the key to developing comprehensive, effective, and predictable treatment plans. It transforms a complex clinical situation into a manageable, step-by-step process. It not only helps you provide the best possible care, but also allows you to communicate the plan clearly to your patient, empowering them to be a partner in their own health journey. Practice this method and it will become second nature, elevating the quality of care you provide. Thank you so much for watching. I hope this detailed breakdown of treatment planning was helpful for you. If you found value in this video, please give it a thumbs up. And do you and I forget to subscribe to the channel for more content designed to help you excel in your dental career. If you have any questions or want to share your own treatment planning tips, please drop them in the comments below. I love reading them and being part of the conversation. Until next time, keep learning and keep striving for excellence.